Muscles of the thigh, we're on page 115 of the lab manual, and we're starting with the muscle sartorius. The sartorius muscle, which is number 2 here, is a very distinct muscle because it's long and strap-like. It's actually the longest muscle in the body. It's thin, and it originates at the ASIS, the anterior superior iliac spine of the ilium, crosses the thigh medially, and then inserts finally on the medial tibial condyle. So this is an interesting muscle because the muscle has two actions. It crosses two joints, right? So it crosses the hip joint and also crosses the knee joint. So when you look at the actions, you just want to think about Ralph Lauren here and how he's sitting here. He's a clothing maker. He's a tailor, I guess, of sorts. And so the sartorius muscle is actually derived from this cross-legged position that tailors used to always sit in. So this position is what you want to think of. So if you were to cross your own legs, right, and sit in this position, think about what you're doing at the hip. And then if you look at the actions, you're going to flex the hip. So you're going to move your thigh up. You're going to roll it out, right? So you're going to move it laterally, so it's an abduct. And you're also going to laterally rotate. So you're going to rotate that hip out. So that's what's going on at his hip. At the knee joint, you are flexing your knee, right, in order to have that rest on the other leg. So that's it. So anytime you cross your legs and sit in this position, you think of the actions of the sartorius. All right, the next 4 are going to be the quadriceps muscle group. So quadriceps refers to 4 muscles, and femoris refers to the fact that it's on the femur, on the thigh. And I took rectus femoris out of this box here because rectus femoris is the only one that crosses both hip joint and knee joint. So it has actions at the hip joint and the knee joint. So let's just take a look at rectus femoris, which is our letter A here. It's the most anterior of our quadriceps muscles. So our origin is our anterior inferior iliac spine, and it's going to insert. So look at the insertions for all of your rectus femoris muscles, or I'm sorry, for all your quadriceps muscles. I want you to change the insertion from patella to tibial tuberosity, because ultimately what these muscles are going to do is they're going to extend the leg. And in order to extend the leg, you're not moving the patella, right? The patella is not the insertion point really. You're lifting up and moving the tibia. So let me explain what's going on here. All 4 of these muscles in the anterior thigh, your quadriceps, are going to form one tendon. The tendon here that you can see, this is going to be called the quadriceps tendon. And you guys should know that. So make that a note for yourself that this tendon here is called the quadriceps tendon. And as it goes over the patella, it changes name. So the portion of the tendon that runs from the patella to the tibial tuberosity is going to be called the patellar ligament. So this should sound familiar to you because we went over this with the knee joint. So these muscle groups really land on the tibial tuberosity. So that's why I want you guys to change that insertion for all of these quadriceps group. All right, so if you look at the actions, the rectus femoris is the only one that also has action at the thigh, right? Flexes the thigh and extends the leg, and everything else extends the leg. So if you look at the other muscles, which are all vastus, they are going to originate on the linea aspera of the femur. So if you remember, the linea aspera is a posterior line on the femur, and they wrap around the thigh. So the vastus lateralis is our lateral muscle, the vastus medialis is our medial muscle, and then our vastus intermedius is deep. So what we need to do is remove rectus femoris, and we'll find vastus intermedius. So let's find that. So here's rectus femoris has been cut. You can see the tendon cut, and we just see vastus intermedius. So there we go. So we can see that we have our one. It's quite large. And those are the anterior thigh. So the posterior thigh, right? You guys know these as your hamstrings. And there are 3 muscles of your hamstring group. And if you look at their origins, they all have a similar origin. It's, well, for the most part, right? Biceps femoris, which has 2 heads, the short head has a different origin. But the all the rest are going to be the ischial tuberosity of the ischium, right? So if you remember that portion of that bone, that landmark. It was the sit bone. So when you're sitting straight up and down, that's the bone that you're resting on. And so here's the origin on the ischial tuberosity. And let's go ahead and find these muscles. So the biceps femoris, biceps means two heads. It's on the femur, and it's going to be the most lateral one of this hamstring group. So this is our biceps femoris. The long head is what you see here. The long head is going to be the most superficial one, and it's going to be the biggest one. The short head is going to be a little deep to it. So right here is getting the short head of the biceps femoris. So if you were in class, you would actually have to take off the long head of the biceps femoris to see the deeper short head. You can see that the short head has a different origin, has the linea aspera of the femur. And then they have different insertions. So the fibula and lateral condyle of the tibia. And the muscles here, since we are coming from the ischial tuberosity and we're crossing the knee joint, so this is crossing the hip joint and a knee joint, we have extension of the hip and flexion of the leg. Okay, semitendinosus and semimembranosus are on the sort of more medial side. So the larger one here, right, this is called semitendinosus, and then semimembranosus is deep to it. This is kind of a flat muscle that kind of goes underneath our semitendinosus. So they both insert onto the tibia, and they're going to also help extend the hip and flex the leg. So the hamstrings all have the same action, so hopefully you can group those together and remember those. All right, here's another look at just another diagram of the hamstring group. And so we can review a little bit here, right? Our gluteus maximus, gluteus medius. We have our tensor fascia lata. We have our IT band or iliotibial band here. Lots of stuff going on. Let's move on to this other picture here. This is another view of the hamstrings, just the superficial muscles removed so that you can see better the semimembranosus. So it's this long sheet-like muscle that goes underneath the semitendinosus. And then here's the biceps femoris long head. And then on our models, right, so if you take a look at the model, this is going to be, there's the IT band, so this is going to be a lateral side. So this lateral hamstring group, that's going to be your biceps femoris. This is the long head, where you can see the number 2 on it. The short head, again, is deep, so we can't see that in this picture. Then number 3 would be the semitendinosus. And number 4, so this little piece here, and this little piece here, that's the semimembranosus. So imagine this muscle going underneath the semitendinosus. All right. So let's look at the next part of this muscles of the thigh. So this is going to be medial. So gracilis, adductor magnus, adductor longus, adductor brevis, and pectineus. So one of the sort of unifying characteristics of your adductors is that they adduct. Okay, so gracilis is the first one that is the most recognizable. It's the most superficial one. It's gracilis, or gracile means thin, so it's a thin muscle that runs down the medial leg. And if you look at the origins, you can kind of group the origins, right? All your adductors have an origin on the inferior ramus of the pubis. This one's going to move down to the medial tibia, and it's going to adduct. You can see the actions: medial rotate the thigh, flex and medial rotate the leg. So that means, right, that the gracilis crosses the hip joint and it also crosses the knee joint. Let's look at adductor magnus. So adductor magnus means it's a big adductor, right? Magnus. So let's look at this picture here. It is a very wide muscle. So just like the deltoid on your shoulder, it has origins on the anterior side of your pubis, and it it attaches to that inferior ramus of your pubis, goes to the ischial ramus, onto the ischial tuberosity. So it kind of does this entire curve. So it has anterior fibers and posterior fibers. And so when you look at the actions, it has opposite actions. So the whole muscle will adduct, of course, is in the adductor group of your muscle of your thigh. The anterior fibers will flex and medial rotate your thigh. The posterior fibers are going to extend your thigh. Okay, and that's because just like the deltoid, right, it has fibers in the front that flex the thigh, fibers in the back that's going to extend the thigh. Okay, So the adductor magnus is deep for the most part. Let's look at adductor longus. So adductor longus is fairly superficial, and it's going to be a landmark in the inguinal ligament that I'm going to talk about in just a second. So looking at our model, right, if we were looking at the models, this is the gracilis. So the gracilis is very thin, it's very medial, and it's kind of easy to spot because it's that smack dab in the middle of your medial thigh. If we go backwards, so we see where number 3 is, that's the adductor magnus. But so is this, and so is this. So our adductor magnus is broad and runs deep to gracilis. And then we see number 5, this is going to be our adductor longus. All right. So let's take a look at the adductor brevis. I'm going to go back to this picture. So adductor brevis is here, right? So it's brevis means short. So it's a short little adductor muscle. It's very deep. You would not be able to see this on our models because it's too deep, but it's going to help adduct and flex the thigh. And then the last muscle in the group is pectineus. So pectineus, you can see a little bit of it here, right? So you can see that the origin is slightly different than the rest. It's near superior ramus of the pubis. And the femur is the insertion, so it just runs to the femur. And it's going to adduct and flex, so the same thing as adductor brevis. So pectineus, if we were in class, I would point you to this tiny muscle right here. There are these 3 these 3 structures that I'll just go ahead and tell you what they are now, because on a diagram you're going to need to know these muscles, and if you had a model on your exam, you would have to know these structures. So what you're looking at here is the femoral triangle. The yellow structure is the femoral nerve, the red structure is the femoral artery, and the blue structure is the femoral vein. So here's little pectineus sticking out. So appreciation of your thigh, this is the femur, okay? We talked about the sciatic nerve previously in another lecture, so this is a really big nerve, as you can see, running down the posterior hip, posterior thigh, all the way down the posterior leg into your foot. So let's take a look. So this is the front of your thigh, so we know that our quads are here, so this is going to be our quadriceps group. Here's our vastus lateralis. Here's our vastus medialis. I'm sorry, I'm flipped. This is vastus lateralis. This is vastus medialis. Here's our vastus intermedius, right? Remember, this was the deep one. And then this is rectus femoris, our superficial muscle. If we go to the back, right, this is our hamstring group. So we can see the biceps femoris, the short head, which is a little bit deeper, the long head, which is superficial. This is our semitendinosus and semimembranosus. So membranosus is quite large in this view, right? It looked not as substantial in the other images. And then medially, right, so this is our medial group. This is gracilis. We have adductor magnus. We have our sartorius, which is runs medially, but it's not actually part of your adductor group. And then we have some vessels here, and we will talk about this vein later on. The great saphenous vein is a vein that is used a lot for bypass surgeries, and if you need a graft, because it's very superficial, it's a big vein, and you can see that it's, you know, right underneath that skin. All right, so here's the femoral triangle. So there's a lot of triangles in the body. I'm only going to deliver the femoral triangle, and clinicians will use these triangles because they're structures that you can palpate, which means feel underneath the skin. And if you can isolate the triangle, you know what's inside that triangle. So let's go over the borders that you can see in this picture. This person has taped off her borders of the femoral triangle. The borders will spell out the word sail. So S is the sartorius. This is the blue tape, right? The blue color. So because the sartorius muscle runs from the ASIS, anterior superior iliac spine, runs medially across the thigh, inserts onto the medial tibial condyle. The AI is the A is the adductor longus, which is their green. So this is one of the adductor muscles that's superficial. And then the IL is inguinal ligament, which is our white line here. So if you are actually mimic this position and sit with your thigh kind of out, abducted like this and laterally rotated like this, you should feel a nice depression in this area. And in that depression, you're not going to see this, but you're going to know that these structures are in that triangle. So what's inside the triangle, this is running in order. The first one coming, so this is the lateral side, so lateral to medial. This is our femoral nerve, okay, N is for nerve. The next one is our femoral artery, A is for artery. 3 is our femoral vein, V is for vein. The E is an empty space, not that it's empty, but just to make the word navel. And then the L is for lymph nodes. So there should be lymph nodes all around this area, but they have been removed in this image to sort of show you these other 3 structures, but just the L stands for lymph nodes. And this is an image showing you just how, this femoral triangle is very useful to feel for these structures. The femoral artery here and the nerve here are used a lot of times for catheters or for like angiograms. If you need to take images of the blood vessels of the heart, they'll actually go through one of these vessels here. So you have to palpate the femoral triangle for that. All right, so we're finished with that one, and we'll start with muscles of the leg next time.